Hi, my name is Sarah, and I'm going to be going over the 5 rights of medication administration for our veterinary patients. These 5 rights serve as an important checklist to go through before you are giving any medication to any patient, and you should go through them multiple times to make sure that you are preventing any adverse events from occurring when you're giving medications. The first right is the right patient, so you want to make sure that you're giving it to the right animal. The second right is the right drug, so you want to make sure that you are giving the correct medication that is prescribed by the clinician on the patient's treatment sheet. The third right is the right dose, so you want to make sure that you're giving the correct dose to the patient. You're not underdosing and you're not overdosing based on the clinician's prescription. And the fourth right is the right route, so you want to make sure that you are giving the drug in the way that it is intended and prescribed. So you want to make sure that if it says it's IV, you're giving it intravenously, and if it is IM, you're giving it intramuscularly, depending on what the clinician would like. The fifth and final right is the right frequency. So you want to make sure that you're giving it in the right time frame that is prescribed by the clinician as well. You want to make sure that you're not giving it too close together or too far apart, because if you give it too close together, it could be too much for the patient to handle, and if you give it too far apart, it could be subtherapeutic. So you want to make sure that it's the exact way that it is prescribed, and if you have any questions, it's good to go up to the clinician and ask just for clarification, because you don't want to give the wrong medication or the wrong amount of medication to the patient. One way that I like to make sure that I do this in the veterinary setting, at my job specifically, is every time I give the medications, I go into a Cubex, which is a computerized program. It's like a computerized cabinet. You go into the Cubex, and right above is the 5 rights written down on a laminated piece of paper, which is really helpful to remember to do it. And now when I go through giving medications, it's kind of like muscle memory. But yeah, that is the 5 rights of giving medications in a veterinary setting.